Um, so again, good morning. I'm Dr. Regina Benjamin. I'm a family physician. I have a clinic in Alabama. It's called Bayou Clinic, and had it for 22 years, and then I became the United States Surgeon General, and then I'm back at the clinic, so 27 years. So one of the things have many of you heard me talk before on this story? A couple of you. So you know that
You're really good, right?
No. I just say the same thing all the time.
You can't get the same jokes twice, then, huh?
I'm a bad joker. I missed the point, missed the punchline. But Biobattery is a fairly poor community. It's people make too much money to qualify for Medicaid, and they don't have enough money to have insurance. So it's the working poor that we talk about. So I can go into a lot of that later. But as Surgeon General, I released the first ever national prevention strategy, and trying to move our healthcare system from a system of sickness and disease to one of wellness and prevention, because we want to prevent people from getting sick in the first place. And that's the only way we really will change health in this country. And being healthy doesn't have to be a drag. Eating healthy foods, some people will talk about it, I hope, can be good. They can taste good. They don't have to taste like a tree. They can taste good. Exercising can be really fun. We do a number of things like walking. I had this whole thing about dancing. Some of you may remember I talked about hair and have decreasing the barriers to health, to exercising. Many women would say, I don't want to sweat my hair back, so I didn't exercise. So we proposed a challenge, here in Atlanta, we did the Bonner Brother Hair Show, and gave an award for the most exercise-friendly hairstyle. In fact, Reed Tuxton from United gave the financial reward for that. So that became pretty popular, and each year it got more and more popular. The hairstylists say, well, we see our customers more than you see your patients. They come and see us, and they do. And so they really got engaged in it. And the New York Times guy wrote an article in the third year about how successful it was, because we had hundreds of hairdressers. We give them a little plaque to put in their salons that says, I'm an exercise-friendly hairstylist. And one of the guys, the scientists or whatever, one of the bigwigs in East Coast, Boston somewhere, says, what's the Surgeon General doing talking about hair? She should be talking about heart disease and stuff instead of hair. And he got blasted in the media. Front page of the Chicago Trib, or whatever, the Chicago paper. It was the third highest call-in show for NPR, because he didn't understand how important hair is as a barrier to exercising. And so things we can do ourselves to improve health. The other thing I want to say before I introduce our panels is that health and financial health are related, and that your financial well-being really affects your health. And we have studies, we have science to show that. We show that the fact that your diabetes and hypertension is common sense. That if you're worried about how you're going to pay your bills, you can't worry about how well you're going to eat. If you can't feed your children, you're going to be worried about things in your stress. Your marriages are falling apart. All the things that we talk about at this meeting really affects your health outcomes. And the last thing is education. And it really should be the first thing, that we can improve all of these by just educating our kids better. And we have science to show that your death rate is higher if you don't have a high school diploma. Just by getting a high school diploma improves your health. You live longer, you don't do anything different, just get a high school diploma. If you get 4 more years of college, impacts it twice as much, just by getting a high school diploma. And your rates of diabetes and hypertension and strokes is impacted and improve just by having a high school diploma. So those things affect your health. So I've got some wonderful panelists, and I'm not going to trust my memory because they really are really good. So I'm going to let them introduce themselves and let you start, Agatha, with tell us about you and what you're doing.
I am Agatha Achindu. I am the founder of Yummy Spoonfuls Organic Baby Food. I am a mother, and I was just super jazzed when I got invited for this particular platform about broadening the definition of wellness. So I really can't wait to get into this. I would let you introduce yourself so we can go over that, and then we can come back and talk about how important this is.
Okay.
Great. Hi, I'm Clinton Wolf. I'm with Optum, which is part of United Health Group, and the largest health and wellness company and health insurance company in the U.S. And I've been there for 15 years. I was telling somebody earlier that I joke I'm their poster child for career ADD because I've done a lot of different things with the company between finance and operations and product development. So I've been in many different parts of the company, which is one of the good things about it. So,
Yeah. Hi. Good morning. I'm Walter Robb. Been in the natural food business all my life with Whole Foods for 25 years, CEO the last 7, and now I'm chairing the foundation's Cities and Kids. So.
Great.
Yeah.
So the biggest issues that we face today is what we call the NCDs, the non-communicable diseases, diabetes, hypertension, strokes, mental and behavioral health issues. And those things can be changed by behavior and the things we do for ourselves. So the panelists, what do you think is our new movement toward this changing our way of looking at health?
I actually, for somebody like me, when you look at the spectrum of the invisible class, the underserved community, I think I've been in 3 different buckets. I have been in the underserved community, I have been an employee, and I am an employer. And when I look from my experience personally, I think we need to take a more holistic approach when we talk about wellness. And also excited when you said in your clinic you're looking more into prevention, which is not what we do in America ideally, because we are more into sickness care instead of wellness. But I would say we have 2 different groups. There is the underserved, which we have to go in and educate them, because if we are going into the inner cities, even if we have organizations that's trying to help and bring food, if we don't educate them to really know what the right choices are for them to make, then we actually miss the boat. We have to educate the parents in the inner cities how to read label, to really understand that if they have $1, they should buy a banana instead of a ding dong, because we are what we eat. So the choices that they make for their kids affect them. So that's one side. But then, as somebody who is not in the underserved population, I have a job, I'm happy, but I don't give my best to my employees because I work all the time. I really don't have time to spend with my family. So that's another area that we can, as organizations and companies, we can support family lifestyle. So it's more looking at a holistic approach, like what's wellness and what's healthcare? How can we get the best of the employees? And how can we serve our community more?
So how does Yummy Spoonfuls?
It's interesting because Yummy Spoonfuls really feeds into this. Yummy Spoonfuls started for me trying to make a difference in our community. I used to go around in hospitals teaching moms how to cook healthy food for their kids because I was so frustrated about the foods that we have in the market, 2-year-old food for babies. All the things that babies shouldn't be eating. And I remember walking into Fulton General Hospital, and they're like, oh, what's your company? I'm like, I don't have a company. I'm just an angry mom. And honestly, that's what I did for years and years and years, because I just knew that I have kids who've never had ear infections. They don't have runny noses. These are things, a lot of the things that we suffer today in America can really be avoided by simple lifestyle changes. And I know you're going to speak to that, but we need to educate parents. We need to educate caregivers that health, how we eat, how we live affects our health. And it doesn't matter how much money you have on planet Earth. If you're not healthy, you can't fully live vibrantly and you can't fully be happy.
One of my other reports was breastfeeding report, Surgeon General's report on breastfeeding. We have to encourage women and support those who want to breastfeed. We shouldn't make them if they don't want to, but if they want to, we have to support them. There are so many benefits for breastfeeding.
Yes.
And we all know the benefits to the baby, but the mother has a less likely chance of having breast cancer or ovarian cancer. And the baby who's exclusively breastfed for the first 6 months of life is less likely to become obese. So just something as simple as breastfeeding and making it normal.
And even to talk to that on the breastfeeding issue, this is where I think it's even bigger than just the mother. It's policies that we have in place, how we hold companies accountable for the things they do, the things they manufacture. It's almost, when you look at the advertisement that's made for formula, I'm not saying it's not necessary. It's there because not every mom can breastfeed. But when you make it look and seem as if there is not a difference, then moms don't even want to go the extra mile to try harder. I was in corporate America and I breastfed my kids. I mean, everybody knew me. I'm on a flight, I'm in the airport, I'm pumping because there was never enough time to sit at home, because I, as an individual, knew that breast milk is the first vaccine for my baby, is the best protection that my kid is going to have.
So insurance companies weren't paying for breastfeeding supplies, and oftentimes they didn't cover those things, and they're very expensive. So what does United Health do about some of that?
Well, I think there are a lot of different ways that you can look at wellness, and certainly the prevention piece is an important part of that. And there are a lot of companies who do look at things like that and say, this is something very important that we do want to provide with that, and we work with them in those situations. One of the things that I like about this broadening, this definition of wellness, is that a lot of people, when you talk about how we view it in the U.S., a lot of it is like this absence of sickness, and it's okay. I'm not in pain. I don't have the sniffles or something, and so I'm healthy. And trying to shift people to that idea of a prevention mindset, you really need to get people to think about it not as I'm not sick today. It's more, am I doing the right things to be healthy, and the nutrition is certainly a key part of that. Both the panelists here because of that. And going back to what you said about diabetes and those other diseases, a lot of people sit here and think about, I got to go and work out, and that's what I need to do to, maybe to be healthy. And it's really hard. I don't have the time to do that. But one of the things that's really important, though, that people don't understand, though, is that if you were to go run for an hour a day, 7 days a week, you're going to burn about 500 calories, and that's going to lose, about 1 pound, is what that works out to. You can get rid of 500 calories in your diet, pretty easily if you are reading the labels, if you are aware of what you're taking in. And it's, a more effective way of being able to maintain your weight and that piece of it. But a lot of people don't look at that necessarily. Is that they're like, I got to be out, I got to be running a marathon. If I'm not, that's wellness. I got to be training for that marathon. And thinking much more broadly about that is really going to be important. The cost of diabetes and these other diseases are, as Regina mentioned, is a primary driver of the cost of care. And, when you look at what the cost of care in the U.S. is, we're spending $10,000 per person now. When you look across all forms of Medicare, Medicaid, employer insurance, all of that, it's $10,000. And that's where, People talk about, geez, it's really expensive. Well, that's because we're spending $10,000 a person on care. And a lot of that can be addressed if people are looking at these diseases, especially the ones related to obesity. When we look at people who have, who are just overweight versus being an uncontrolled diabetic, they're about 6 times more expensive. It's about $18,000 or so a year for somebody who's uncontrolled, who has uncontrolled diabetes versus, it's about $2,500, $3,000 for somebody who may be overweight but is pre-diabetic. And that's certainly something where you can, through lifestyle, you can reverse that. And you've got to be able to make those shifts if you're going to get that cost under control. And that ties back to this other thing with the invisible class and all that, because it's, when you look back over the last 10, 15 years probably, and everybody's talking about, with, the populism that's going on right now, and a lot of it is tied back to economic anxiety and the fact that, average wages have not gone up, hardly at all. But as an employer, if you're sitting here saying, okay, I've got a budget of, 5% to give to, for my employees' raises next year for my labor costs, but my insurance is going up 3 or 4%, well, that means I only have 1% or so, for the financial raise that I can give to my employees. And that it starts to create a loop there. So, it is something that is going to make a very big difference in everybody's lives on a go-forward basis, and that's why it needs to be addressed, and prevention is certainly the way to do that.
With those statistics, one of the things with the non-communicable diseases, meaning that it's not infectious disease, there are those diabetes, hypertension, they add to cardiovascular disease. And this year alone, we spend $400 million as a nation on cardiovascular disease every single year. And just by doing things like walking, and I'm a big advocate for walking. We have this America Walks, and if you haven't seen this group called Girl Trek is this African-American girls who started out just getting people to walk. We have almost over 1 million girls who are now walking together. There are groups here in Atlanta that walks Girl Trek. And we kind of link it to civil rights, not SL, but this one is the C, with Harriet Tubman, and she marched to freedom. You can march for your health, and that's the
right.
sort of thing. And so you might want to Google Girl Trek, but what you're describing is really important, just things we can do. So what about Whole Foods? It's not accessible to some of the people I see. One, because we don't have the Whole Foods in town. But.
Well, I'd start with the question and say, one of the things I've been doing the grocery thing a long time. People's definition of what wellness is, what you're saying has really changed. It's not just the absence of sickness, it's also the presence of vitality and thriving. So it's not just your physical health, it's your emotional, it's your psychological, all those aspects of spiritual health. It's all those things taken together. People have a much more robust sense of what it means to be healthy now than they did 5 or 10 years ago. I'm going to say, obviously Whole Foods has a point of view that what you eat makes a difference in how you feel and the quality of your health, and that, if you look at from a big picture in this economy, healthcare is about 20% of the economy. It's a huge amount of dollars, and even a modest investment in changing your diet or in lifestyle is going to make a huge contribution to the overall economic strength of the company. But I suppose the reason that John wanted me to come here is because we have, over the last number of years, built stores in inner cities. So 4 in particular: Detroit, the south side of Chicago, and Englewood, Newark, which just opened, and in New Orleans, where we partner with Janet Davis, right? Raise your hand, Janet, who started something called Liberty's Kitchen, which was to teach the underserved culinary skills and to give them ability pathway to a career. And we partnered with Liberty's Kitchen, and we kind of helped that happen. So
I work in New Orleans.
Oh, you work in New Orleans, okay.
Exactly.
So Liberty's Kitchen, you know Liberty's Kitchen.
I know
so,
where Whole Foods is and what it used to be too.
Yeah, in Michigan. Okay, all right. Well,
It's great.
you're right. I mean, part of why we wanted to part of why I wanted to build the stores in the inner cities is to break down this idea that healthy food or healthy living is somehow not accessible to all people. It should be accessible to all people, and so I can talk whatever you want about our experiences of building.
Tell me
these
about your
stores in the
program
cities.
with the kids, don't you?
Yeah, and the other thing we started a program called Whole Kids Foundation about 7 years ago, and that is to put salad bars in schools, put gardens in particularly underserved communities, and also to teach the teachers about healthy eating education because they're so pressed for time. So we have that foundation, and we also have Whole Cities Foundation, which is all about access and community in the inner cities. So, and then we have stuff for our team members. We have a discount program based on if you do a test every year, you get discounts up to 30% based on your blood pressure and your body mass and that sort of thing. And we work on that with United Health. Plus, we also give immersions to our team members so that the sickest team members go to these programs which are a week long, which we pay for them and their spouse. And usually by the end of that week, they're off their meds. They understand the role of diet. So we have that program and the discount program, and we have a number of other things to help kind of encourage a culture of wellness at the company.
Great. I'm going to open it up so you guys get ready for your questions. But one of the things we did on the East Coast was I worked with the First Lady on Let's Move, and one of the Let's Move initiatives gave people these, the food banks had fresh foods, fresh produce, and the fresh produce always would be there at the end, and nobody was using it, wasn't taking it. They take the canned goods, the other thing. They didn't know how to prepare it. So we had to put together something to show how to prepare it. And I remember meeting someone from Whole Foods in New York who had worked with the kids. That's what I kind of knew it. And she said she took these kids from inner city to a Whole Foods, and some of them had never seen a yellow banana in their life. They thought bananas were brown. They had never seen one yellow. So we take this stuff for granted, particularly
That's
us in
right.
the South, because we can grow our own gardens, but in the inner city they can't. So
In Baltimore, which is one of the worst examples I've seen of disparity of food access, the life expectancy in West Baltimore, Freddie Gray area, is 16 years less than the city of Baltimore. And meeting some of our own team members, they said they've never actually seen fresh fruit, that they thought fresh fruit cocktail was fresh fruit. They're simply not the stores or the access in that part of Baltimore.
So, you want to ask them anything? Go ahead.
I have a great question. Actually, I have a lot of questions. It's fairly long. I'll make sure I wrote it down so I apologize for the script. So this one is for Mr. Wolf, who's United Healthcare. So just a little bit of background. I'm a clinical and sport performance psychology consultant. So the wellness piece kind of drives a lot of the stuff that I do from a mental health, behavioral health standpoint. So my question for you is, as a provider in the behavioral health and mental health field, and just thinking about the preventative side and the relationship with insurance reimbursement for services, in order to successfully use both mental health and behavioral health coverage, there has to be a provisional diagnosis that's given to individuals that seek services, which then pathologizes the issue. If the individual has an experience, how do we kind of close that gap between pathology compared to preventative and still be able to get the resources that the individual needs without having to necessarily do provisional diagnosis?
So I'm going to translate that for you. Basically, she's asking that if you have a behavioral health, like I have people come in and say, I got trouble with my nerves. That's what they'll say. So in order for an insurance company to pay for it, they have to have a diagnosis. If they get a diagnosis, then they're labeled. Is that your question? Okay.
Yeah. Well, and I think, a lot of that ties back to the work we do with the medical societies, because that is really the foundation for where we are making our payments from, and so that is kind of a question, and tying it back with the society to say, okay, how do you, if you're going to have insurance come in and pay for something, then there needs to be a diagnosis associated with it that is not labeling, effectively, and that I think is a tricky area there. It's, certainly people.
It does, but they end up with that label in their record. So
Right, yeah, exactly, and because that's the way the payment methodology is set up. It's unfortunate that, people can certainly get, see behavioral health specialists, and if they feel they don't want that label, they end up paying for it out of pocket, which is, the difficult situation with it. But that is the foundation, it's a diagnosis situation.
we need that change in health system reform.
Hi, my name is Roy Johnson. I'm a columnist at AL.com, the Alabama Media Group in Alabama, which you know is still one of the fattest states in the nation. And so people like to go working to try to change that. I also have an employee wellness consulting practice working with municipalities and small businesses to create a healthy workforce. So I'm interested in the food desert because that is a real issue, and I want to know some of the successes maybe that you've had with your stores, what you've learned, and what incentives have you created even for customers, because there's an education component to that too. What is healthy food? How do you prepare food? That is another transition that a lot of people have to begin to understand how to prepare food in a healthy manner. And so all this becomes a part of the lifestyle. The food desert issue is a real one. So I'm happy to hear that you all are addressing it. I'd like to hear the success and then what some of the strategies are for rolling it out even further.
Congratulations for what you're already doing to make a better world. I mean, first of all, the term food desert is not one that people, it's one that you probably ought to let go of, because it's kind of implies that somehow where people live there's nothing going on. It's kind of a
in terms of healthy food,
I think they prefer the term underserved areas because there's just less access. But first of all, if you go to the Economic Research Service website, the USDA, there's over 6,500 underserved areas in the United States of America. So those are defined as areas without access to a grocery store within 2 miles, or whether it's, there's lots of definitions. But, what I've seen, and if you look at the public health statistics, the disparity in life expectancy, in incidence of disease is absolutely stunning. It's almost immoral. It's almost immoral that you could be in a city, when we first started in Detroit in 2009, of course, there was no grocery store in Detroit since the 50s, none in the city of Detroit, within the 8 mile. And again, the life expectancy there was 10 years less. The incidence of heart disease, diabetes was rampantly higher, just as public health statistics. So what I've learned from our experience is built 4 stores now. We just opened one in Newark. I started getting calls from Rahm Emanuel and Cory Booker if we would build a store in their city because they've got those sorts of disparity problems. But I've learned it's not just the access. It's not just building the store. It's also the education, as you mentioned. Without the education and culturally appropriate education, nobody in the black community wants to hear me talk about fixing something. They want to hear somebody that looks like them and talks like them. It's going to be able to understand their cultural traditions and how to cook greens and how to do it. So we had a Kua Wilbright that's a PhD in nutrition who started a program in Detroit, and we started offering the classes for free to the community and built up a community of 200 people who were then empowered to teach. And they were, so when she first came, she went to the churches, she went to the synagogues, she went to different places to help. And so the education piece around meeting people where they are and giving them the tools is essential. The access without that, without culturally relevant education, isn't going to work. And the third piece I learned is about the power of the community and participating as a member of the community. Without those connections and relationships, without the support of the community, involvement of the community, it's also just looks like you're a stork that dropped in with a baby and it doesn't really work. So it's all 3 of those things together that start to move the needle in terms of people's health. So we've done it 4 times now. And by the way, another thing is the SNAP program, because in those communities you find the SNAP usage is considerably higher.
We used to call food stamps.
Food stamps, SNAP. And what I've learned about that is that the SNAP shopper only has so much money, and they get the SNAP twice a month. And that drives a particular buy. They tend to buy larger quantities or frozen food or food that, as opposed to the fresh food. And so in the south side of Chicago, in the store we built in Englewood, the average per capita income is around $21,000. So it's a big stretch for our company. But in terms of serving the community, learning about those patterns and how they shop, they literally only have that so much, and they have to make it work. And when they shop twice a month, they're not into the healthiest pattern. So how do you start to support single mothers, single fathers who are on the SNAP program to be able to make sorts of changes in the way they're thinking about their diet, the way they're shopping? I could go on, but I'll stop there for now.
One of my
Is that helpful?
Oh yeah.
Along that cultural thing, it was early on in the clinic. We had this guy, he was a white guy. I was trying to teach him how. I had him talk to the nutritionist. She talked to him for like an hour and a half. And then afterwards, I asked him, what did you learn from her? And he says, what are Brussels sprouts? That was all. He says he had no idea what Brussels sprouts were because we'd never seen them. So all that time.
Exactly.
So welcome to the people who just joined us. We started a little while ago. We started like a half hour late. We tried to wait for you, but we know you were in the session. We're in the question and answer session right now, so we had another question over here. And when you answer, just tell the rest of the people who you are and what you're doing.
Actually, I want to piggyback on to answer your question about the whole, it's so important with education. Whether we want to call it the underserved or we still call it the food desert. Even if we take a fresh food stand and put it right there, if we don't educate the parents, the people in that community about the importance of this food, it wouldn't mean anything to them. So I think what Whole Foods is doing today is really important, trying to get this educational piece. But for those of us who are part of this community, or whichever community, let's just make it a point. You can never teach somebody too much. So show them how to read label, explain. But yes, you're working on a very tight budget, but you get more for your dollar if you put that money towards real food instead of some fluffy snack that has no nutritional value.
So Agatha, tell them who you are.
Working with schools, I've heard that some schools, particularly at the elementary school level, if they teach the kids about it, they go home and tell their parents.
I tell you,
They say, hey, mommy, let's do this, or hey, mommy, let's do this.
we have put the
You're
board.
with, tell them who you are, because there's half
okay.
the room's wasn't here when we introduced
Well,
ourselves.
half the room. I'm Walter. I was with Whole Foods 25 years, co-CEO the last 7, and now I've been working on our foundations that we set up. And I think that's why John wanted to come talk about the foundation. But Whole Kids Foundation, we talk about, we put 4,000 gardens for a lot of inner city communities. And when kids put their hands in the garden and they grow the food, their relationship with food changes for the rest of their life. When they grow a vegetable, when they grow fruit, when they taste it, when they start cooking it in their classroom, I've just seen it myself. I've just seen most recently in Chicago and Inglewood on the south side, where it just changes the way they think about things. So the garden's incredibly effective. The salad bars.
When you mentioned about the garden,
sure.
and in DC, I got to visit that garden in DC, and exactly what you said happened. But the other thing I saw happen, they have kids during the summer, they pay them like $25, $50 a week or whatever. This one girl said she never had to get up on time. She was getting up on time to come to work in the garden now because her friends had to do her work and pull the weeds if she wasn't there. It taught her work ethic.
Teamwork and
that sort of thing, which I thought was interesting.
The other thing is just that I mentioned the 3 things: access, education, and community. Our Whole Cities Foundation is basically giving grants to individuals that are doing healthy eating education in the community, so supporting entrepreneurship contests, and also just basically giving them grants to innovate against how to solve some of these problems. Some people are creating races for the community, some people are creating tasting fairs or health fairs, some people are creating individual products that they're selling. And when we built the store, we could put them on the shelf. We could put 50 entrepreneurs from a community on the shelf and give them a start with their business. So we set up community kitchens like the Liberty's Kitchen, where folks can learn food service skills. So it's really much bigger than just putting a store in there, as Agatha said. It's about thinking more holistically about how you're going to engage with the community in a way that's relevant and meaningful.
Yes, we'll go here.
Good morning. My name is Kelly Burton. I'm with Nexus Research Group. We help our clients carry out impactful social programs. And my question is for Walter as well. When it comes to food access, we've long been told that in order for a grocery store to enter into a particular community, certain conditions needed to be in place. There needed to be a certain density, there needed to be a certain household income. That has long been the model. So in light of the work that you've done in inner cities, I'm very familiar with the work in New Orleans. The conference is beautiful. It's really great work. But in light of that, would you say that you all have offered a new model? Are you subsidizing your stores within inner cities? Or are they profitable on their own?
So it is a different business model because the rent is substantially cheaper, and in some cases our developers have gotten, for example, in Chicago, our developer got some help from the city to be able to build a shopping center. We don't take those subsidies directly, but we do get the benefit of the lower rent. So the model's lower, so the gross margins can be lower. But also for any grocery store, you price to a community. So yes, in any grocery store, the prices slightly vary by community. That's the way it kind of works. So for these stores, yes, we're not running a nonprofit. They're a for-profit business, but I'm not going to say they make a lot of money. Well, Whole Foods is a big company. We have almost 500 stores, and so we can afford to build some that are purely about our mission of serving people with healthier food. But they're not money losing. They're just not a lot making a ton of money, but they are serving the community, and we're kind of learning and evolving how we can stretch and go. So it's a and also I think particularly in Detroit, I think that was the first one that opened in 2013, and I'll never forget that day, May 5th, 2013, that we opened the store the way that in all my career as a grocer, that day of feeling the community come together in a way that they didn't think was possible. It represented hope for them. The grocery store represented hope for them because they didn't have one prior. So I think there's more to business than just making money. Business is about serving the community or serving the world with your purpose as an organization, and the money will follow to the extent that it does. So, but we're not running a money losing thing. We're a public company, so that it doesn't really work. So,
Great.
Question more so to Walter and also I was thinking about how certain places give free samples or give certain type of seminar. Like Home Depot does a weekend seminar for kids, primarily to intrigue their interest. And as an educator, I was thinking of going back to this thing with starting at the elementary level or what have you. But have you ever thought of doing maybe like a chef, seminar, for
Like workshops?
and all your local, which I know would attract customers and maybe some incentive to students more so. What you said will trickle up to the parents. And I think that would also increase, the business as well. And even with the yummy foods and, the healthcare, maybe doing seminars in different grocery stores. We're cooking to live. Strategies to promote also your business as well as promote overall wellness, which would be an avenue to pull in more holistic thinking.
Where are you from?
Born and raised.
Here in Atlanta?
Yes.
But I'll let you guys answer. But there are a number of cooking classes, because we talk about people don't know how to cook. We're doing a number of community cooking classes. We do it in Alabama. I know that Morehouse School of Medicine's been doing it here in Atlanta, teaching how to cook healthy, and those on a pretty basis I'm sure you guys have some.
So I'm Agatha Achindo. I am the founder of Yummy Spoonfuls Organic Food for Babies. I am. Thanks, Walter. Last year in December, what we did, we actually gave over $500,000 worth of fresh organic food to those in need. I don't want to say homeless. So we went to shelters. We worked with the Today Show. We worked with Feed the Children, because I was talking to a lady, Grace Bunny, and she worked with a food pantry, and she was telling me that they never get anything healthy at the food pantry for the kids. And I said, that is so sad. That's a problem, because nutrition, every child born, it doesn't matter whether they are born in a shelter or they are born in the White House, deserve access to the best food, because they didn't choose where they were going to be born into. But nutrition plays such an important role, and which is one of the reasons that Yummy Spoonfuls was actually founded, because my idea was to make the type of food that some of us who have the time make at home. That's clean, it's organic, doesn't have even ascorbic or citric acid, because you are somewhere at the side of the street, your child shouldn't eat crazy food. That was the foundation of Yummy Spoonfuls. That we were able to donate that much food. It wasn't like the easiest thing. We're not a big company, but it was important for us that in December, during the holidays, every child should eat the type of food that you buy from Whole Foods, from Target, and all the stores. You can get it at the shelter. So it's important. And we offer workshops around the country teaching moms how to make simple things, healthy snacks for their kids. Because with the little budget that you have, It takes just a little bit of effort for you to eat like anybody else. When I came to America, I couldn't afford the type of beef that I was used to, so I was a vegetarian for a while because I had to eat grass-fed beef and I couldn't buy it. So I would rice and beans, that's my protein, because I knew the difference. So the workshops and just teaching moms is important, and we do it. And there's a lot of companies that do it. I'm not sure in Atlanta where you can look, but there are places here that offer free workshops. And even Whole Foods, we used to do a lot of sampling here when we were in Whole Foods, a lot of sampling every Saturday and Sunday, and people will come in and try different things.
Yes.
I think it was.
With the initiative being started targeting children at a younger age, are there any workshops or any programs that are set up to actually work with the public school system in being able to incorporate healthy eating or teaching healthy eating with inner city youth within the public school system? There are a lot of school systems out there where over 80% of the students there get a free or reduced lunch. And that would definitely be a place where impact would be necessary and is much needed. Where children are complaining about foods that they're eating where things are tasting like cardboard, or they're getting low quality meat, whether it be beef, chicken, or whatever else.
You know why? You know why? Because the government spends like $1 a meal per person. I mean,
Yeah.
they basically have, with this, they don't allocate any money for those sorts of budgets, and then most of that budget goes for the labor to produce it as opposed to the ingredients. And they use, second of all, then they also use just the surplus ingredients that the government buys as opposed to, so yeah, there's a problem right at the get-go from the funding for those programs. So yeah, they are giving them a meal, but the meal is crap. So,
The other thing they're doing is we have the My Plate.
I forgot you work for the government, so.
I used to, just in case you didn't know, Obama administration's gone.
Well, I know that. Secretary Vilsack is a very good friend of mine. He actually got the thing up from $1 to
He
$2,
did.
but
And he and I worked, Secretary Vilsack and I worked on My Plate.
Yes.
And in
That's
Hispanics,
right.
it's the Mi Plato. It's basically to teach kids how to eat healthy. The issues you said are very real about the crappy food. I mean, and each state has its own. And part of it is USDA, other part is the Department of Education, and you get into bureaucracy. But the My Plate teaches them how much of each particular thing to eat, and it's very simple. Instead of that long pyramid that they used to have and complicated, it's just you a certain amount of protein, a certain amount of vegetables, and starches, and that's simple. But teaching them how to eat healthy and less sugar-sweetened beverages and more water. You see kids drinking water now. We grew up drinking sodas and stuff. They'll be drinking water like it's and healthier. So like you said, they're taking it back to their parents. But
Well, that's something that makes me optimistic for the future, and that we are starting to see obesity rates in children go down a little bit. And part of that with children is repetition. It's a very effective way to get to the adults as well. But I'm from Chicago, and by the way,
What's your name?
Clinton Wolf with Optum. I'm from Chicago, and I work with a nonprofit there, the Robert Crown Center for Healthcare Education. One of the things they did is they would work with a range of schools, and they actually work to integrate healthcare education into the curriculum. So in their math and science classes, they would talk about what are calories and how many calories you should have in a meal. And so if you're having, if a meal is 500 calories and you're having 6 meals a day, that's more than your 2,000 calories a day you should have. So it's one of those things where you've got to do more than one thing. I mean, going back to marketing, you got to hit them 16 times with a message before they remember it for the first time. And that's kind of what you've got to do. So they need to be seeing it at the grocery stores, hearing it in the schools, hearing it through other methods. And it's making a difference.
There's a difference between teaching them and then making that accessible.
Right.
Because a lot of these children, that's their only meal.
Mm-hmm.
Their only meal is the breakfast that they receive in elementary school or the lunch that they receive in elementary school. So what can we do to impact that? And what programs are there available to even start with one school to work with actually, even if it's just one meal a week, being able to have a healthy meal so they know what a healthy meal looks like and what it tastes like.
So there's a great organization called No Kid Hungry, which is run by Billy Shore and has a lot of the restaurateurs involved in it. And that there's about 18 million kids in America that still don't have enough food. So No Kid Hungry, you might want to check that program out. Our Whole Kids Foundation, we actually have a program where it teaches the teachers, because the teachers, they help them in the classroom to actually talk about healthy eating and incorporate peanut butter or salt or whatever into their curriculum. So you can go to the Whole Kids Foundation website, wholekids.org, and you can read about that program there. And then Whole Cities Foundation is doing the same thing in terms of educating in the community with respect to healthy eating. So without the education, as everybody said, the access is not enough in and of itself. And by the way, I'll tell you, some of the public school districts are some of the worst in terms of their resistance. If you go to them, as we did, and try to say, we're going to give you a salad bar. We're going to give you a salad bar. Not only just give you a salad bar, we're going to give you the program of how to set it up and how to use it. The public school administrators are some of the worst, most resistant to change. A, because they don't have the budget. And by the way, there's no more lunch ladies. Like when we grew up, there was a lunch lady making the food. They don't have those. They don't have them anymore like that. So some of it's the institutions themselves are kind of resistant to this sort of change around pressure. The other kids don't want it, this and that. In Austin, our hometown, is the worst. It took us 5 years to crack. People were going to give them this program for free, and we have some credibility. So you've got places to look where people in the public schools themselves. There's a great lady named Betty Wiggins in Detroit. Betty Wiggins is the food service person for the city of Detroit. She's been there forever. You know Betty? She's fantastic. And she's one of the ones that bucked the trend early on and started bringing kids healthy food and buying from local ranchers and farmers and that sort of thing. But she's an exception rather than the rule.
So we need your help, and when you're starting to elect your, your educational school board members, those are the things that you need to ask them and make sure they answer you properly. This lady back here had her hand up. You still? Yeah. Yeah.
I just walked in. I'm moving that around here because I hear what you say, and I hear what you guys are saying. But we're not seeing the common ground here. One day for my son, I'm from the Caribbean, so I'm letting the school food. I've been fighting with the public school system for the last 12 years. He's right, because I had actually a case on the board with kids to incorporate and let the YMCA at the time see if you give the kids and how you present it to the kids, they would eat it, they would love it, and how people think eating healthy is expensive, but it's not. It's how you stretch it, okay? Because you can make a fruit salad out of $10, and I can see this everybody eat. But I'm not sure what's your name. I really will guess.
Benjamin, Dr. Benjamin.
Yes. And when I hear the government do meal plates and all of that, but there's no choices. I volunteer at my son's school, and people know me as the lady who put rice and curry chicken and veggies and fresh fruits and water for my son. He don't drink juice. He was never introduced to juice.
So you came in late, but that's exactly what Yummy Foods is about. That's what she's did her whole presentation. Exactly.
At the government standpoint, I just want to know when will you start listening, really going to the hand in hand, incorporated with us parents, coming in and demanding that the schools, we understand liability and allergies, we are not dumb. Everywhere has it, but when would we get you guys to come in and give these kids more than pizza or fries?
I didn't work for that part of the government, but I will tell you that what my whole thing as Surgeon General was promoting exactly what you're saying, and I give them the policy and say you should be doing this. It's up to the school boards and the Department of Education to do that. But what it comes down to in reality is you got to get the right people on your school board to make sure that you're going to get what they're responding to you as a citizen. They're not. Their whole goal is to get reelected, and so you have to hold them accountable because they really need to be doing those things. And if you're not there to speak up like you've been and get other people like you, then it won't happen.
And I think I'm Agatha Achinu, founder of Yummy Spoonfuls, and I can totally relate because you sound just like me in my school. But the problem in our country today. It's a matter of demand and supply. We don't have enough moms like us. The reason we have all the shittiness out there is because somebody's buying it. Nobody puts food out there that nobody buys.
What did you just say?
I tell you,
You said sickness, right? Is that what you said?
I said sickness. I swear, this is how frustrated I am. I used to look, I wrote all the way to Congress because I picked out one time, I will never forget, in 1996, I'm looking, on the label it actually said lemon cream pie. And when I looked at that label, there was no cream. I called the company and there was no lemon. And I'm not kidding. I called this company, they're like, well, it has lemon oil or something. This is a pie. I'm like, what the heck? Where is the cream? And I wrote a letter all the way to Congress. This is how frustrated I get when it comes to food, because especially we make choices for our kids. And when they are older, they have all these man-made diseases that we could have avoided them, right? We have kids who are sick, they are adults, they are sick, and you're there sitting with so much guilt. These are things that they need to happen with just a simple lifestyle change. But we don't have enough more, because even in your same school, you have moms who are looking at you going, why does she talk so much? Why does she care so much? But we should care. So we need to do our part in the community, because a lot of companies are not non-profit, but they want to do good. Companies like us, we want to make money doing the right things. But the communities, we have to step up. Don't vote people who are going to help you kill your kids, because all this food is getting them sick. We need to be mindful and get your parents together, explain to them, like show them what their kids will look like in 20 years. Because you always will pay the piper. It's not today, but down the road, when you're eating all this crazy food, down the road, somebody is going to get sick. That's just the truth. And then start pushing, because it's not so expensive to eat healthy. It just takes a little bit more time.
So we run out of time, but we had another question in here that I kept. Nobody's raising their hand. Oh, sorry. Yeah, go ahead.
Yes.
I'm going to do you two, and then we'll go.
Good morning, everybody. Fully respectful that now is consistent primarily of individuals in the nutrition field, but considering the definition of the seminar, what is your take on the balance of well-being and wellness, be it dealing with individual stress levels?
Yeah, I'll answer that for you in a second. I'm going to ask her question too. What was your question as
It
well?
wasn't a question. I was just going to make a comment, especially for individuals who are asking about agencies here in the Metropolitan Atlanta area. There's an initiative that's called the Atlanta Regional Collaborative for Health Improvement. And there's also the Partnership for Improving Community Health that is looking at use of physical activity, healthy eating, and also tobacco smoke in the environment.
Yeah.
In terms of what that means to total well-being. The Partnership for Community Improvement is a Fulton County health and wellness initiative, and it does have an early childhood component in terms of how to train parents to prepare healthy meals for their children.
So that's one you may look into. And, I apologize for those of you who had to come in late because the session was over, but we spent the first part of our conversation talking about how we change our health system from one on sickness and wellness to one on sickness and disease to one on health and wellness, and that we kind of talked about exercising and walking, and food didn't have to be bad. We just happen to have a couple of folks from food, but we also have insurance, and mine is all about prevention. So we have talked about and the people that we see are the invisible class, or the people who work for a living and don't have insurance and they're struggling, but you still can be healthy. And you can be healthy by doing the things that we talk about, behavioral changes, and that's what we're trying to get to it. And the other thing I would just, this is my personal opinion, is that you can't wait for the government to do something for you. You've got to do it yourself. And government responds to those who elected them. And so we need to take our own health into our own hands and take control of our lives. And that starts with exercising, walking, dancing, having fun, soul stroll as we call it, eating well, you don't have to eat everything well. You can have, like the First Lady says, you can have the ice cream every so often, you can get an ice cream cone, but be aware of it and be mindful of it. And I think you guys have done a wonderful job in portraying that. And so we need your help to make us a healthier society, to move our nation to a more healthy and wellness society. So thank you, panel, for coming.